Bismillahirrahmanirrahim. We talked about innervating the body wall structures by the sympathetic nerves and the neural pathways the sympathetic nerves took in order to get to the structures in the body wall, such as the sweat glands and the smooth muscle of the hair follicles and the cardiac muscle. So now we will talk about how the nerves how the nerve fibers of the sympathetic nervous system, they need to innervate the visceral structures which are present in the abdominal cavity as well as in the pelvic cavity. So there are visceral organs, for example, in these cavities which need to be innervated by the sympathetic and the parasympathetic fibers. So how is that accomplished? What happens is that fibers from about T5 to L2 levels, the preganglionics, they move out of the spinal cord in the white ramus, and they reach the sympathetic chain of sympathetic ganglia over here, but they do not synapse here. Neither do they ascend up or down the chain. They go right through the chain forwards into the abdominal cavity or the pelvic cavity. So, like shown over here, these fibers, these preganglionic fibers, they move right through the chain, sympathetic chain. They pass through the chain, and they enter the abdominal cavity. Now there are other ganglia that are present in the abdominal cavity, and they are just present at the posterior abdominal wall near the great vessels that come off the abdominal aorta. So these are also known as the pre-aortic or the prevertebral ganglia, which are shown over here. So these fibers which are coming, and they're going to innervate the visceral organs, or the organs inside the abdominal cavity and the pelvic cavity, they are known as the prevertebral or the pre-aortic ganglia, and they come off the abdominal aorta, and they're surrounding, and they're not present over there accidentally, but they're surrounding the major vessels that come off the abdominal aorta. For example, the ganglion that is around the celiac trunk, which comes off the abdominal aorta, is known as the celiac ganglion. The ganglion that is near the superior mesenteric artery is known as the superior mesenteric ganglion, and the ganglion that is present near the inferior mesenteric artery is known as the inferior mesenteric ganglion, and so forth. So, and there's a reason why they are present around these major vessels, which we will just discover right now. That now these preganglionic fibers, they travel in the white ramus. They've passed through the ganglia, the sympathetic chain ganglia, and then now they have to, in order to reach the end organs, they have to synapse. They cannot reach the end or target organ directly. They have to synapse on the postganglionic neurons, which are present inside these ganglia. So they synapse over there in these ganglia. These are also known as collateral ganglia, the prevertebral ganglia, or the aortic ganglia, and they synapse over there. And then the postganglionic fibers, they come out of these ganglia. Now, we know that the postganglionic fibers which come off the sympathetic chain, they use the spinal nerves in order to get to the target organs, as we discussed earlier in the previous video, that they hop onto the spinal nerves, and the spinal nerves take these postganglionic fibers to their respective target organs. But since we've passed up the opportunity of doing so, because we've passed through the sympathetic chain and we have come into the abdominal cavity or the pelvic cavity, now there are no these postganglionic fibers. They can't do that. They cannot hop onto the the spinal nerves. Sorry. So what happens is that they use the arteries, the branches of the arteries that they're nearby. Arteries are present over there. That's why these ganglia are surrounded by the arteries that come off, major arteries that come off the abdominal aorta. So they tag along these branches which come off the branches of the celiac trunk, and they follow those branches and they reach their target organs through the branches. For example, the postganglionic fibers coming off the celiac ganglion will tag along the branches of the celiac trunk, and the postganglionic fibers coming off the superior mesenteric ganglion will follow the branches of the superior mesenteric artery, and then they're going to innervate the target organs, for example, smooth muscle of the gut and the glands present in the gut. And similarly, inferior mesenteric ganglion and so forth. These postganglionic fibers are known as the sympathetic splanchnic nerves. Sympathetic splanchnic nerves, because they are innervating the organs inside the pelvic and the abdominal cavity. And these are the pelvic splanchnic nerves, or the lumbar splanchnic nerves, and these are the thoracic splanchnic nerves. But together, both of them are called the sympathetic splanchnic nerves. So now we've pretty much solved the entire problem of the sympathetic nervous system. We have innervated, we have discovered how the body wall structures are innervated from top of the head to the soles of the feet, and the organs, how they are innervated in the sympathetic system. Now, there's only one thing left, and that is how does the sympathetic nerves get to the front of the head? The front of the head doesn't receive any spinal nerve, and no spinal nerve reaches the front of the head. So how do the sympathetic nerves, these sympathetic preganglionics and postganglionics, they reach their target organs in the head? So how the sympathetics get to the head structures in the head? It uses a combination of the things that we have discussed. We start at the T1 level, which is the highest level in the thorax, in the thoracic part of the spinal cord, and the preganglionics, they get out into the white ramus. As the white ramus, they enter the thoracic ganglion. They do not synapse over there, and they ascend to the highest ganglion, that is the superior cervical ganglion, and this is the last chance for this fiber, the preganglionic fiber, to synapse with the postganglionic neuron. So it synapses over here in the superior cervical ganglion, and then the postganglionics, they cannot use the spinal nerves because the spinal nerves don't go to the head. So what are they going to do now? How would the postganglionics get to the structures inside the head? Well, we know that in the abdominal cavity, they use the branches of the abdominal aorta to get to their target organs. But so similarly, we have the external and the internal carotid arteries in the neck, which pass right next to the superior cervical ganglion in the neck. So these postganglionic fibers, they hop onto the branches of the internal and external carotid arteries, which go everywhere in the head, and they innervate, they supply all the structures inside the head. The blood supply is over there, so we have a pathway of getting these postganglionic fibers, and they hop onto the branches of the internal and external carotid arteries, and they supply the structures inside the head, the sweat glands, the dilator pupillae of the iris, and the superior tarsal muscle of the eyelid. All these are smooth muscles which elevate the eyelid. Now, take note that this pathway is a fairly long pathway. Starts in the thorax over here, goes into the neck, and then it hops onto the internal external arterial system and goes right to the head. And it's a fairly long pathway, and whenever there's this long pathway, any damage or any lesion along this pathway could lead to clinical signs and symptoms. And for example, if you lose sympathetic innervation to the muscle that elevates the eyelid, example, elevator palpebrae superioris, so the superior tarsal muscle, then there will be a drooping of the eyelid. And if you lose sympathetic innervation due to a lesion somewhere to the muscle that dilates the pupil, then you will have a constriction of the pupil. And if you have damage to the sympathetic fibers along this pathway, anywhere along this pathway, then you will have decreased innervation to the sweat glands, and you will have anhidrosis, loss of sweating in that area, dry skin over there. So all these three clinical signs, loss of sweating, constriction of the pupil, and the drooping of the eyelid, a combination of these is known as Horner's syndrome. So when you have these clinical signs together, you immediately know that there is some kind of damage to the sympathetic fibers that are coming off at the T1 level, and then you're reaching into the head. As the arrows indicate, it could be the lesion could be at the level of the superior cervical ganglion, it could be in the middle cervical ganglion, it could be in the preganglionic fibers coming off from the T1 and in the gray ramus and then they're ascending into these ganglia. Or it could be the hypothalamic fibers, which come right from the hypothalamus, and they are the upper motor neurons that are controlling the lower motor neurons, the preganglionics. The preganglionics are controlled by fibers coming from the hypothalamus, so they could be damaged. So altogether, these lesion anywhere along this pathway at any of these levels could result in a Horner syndrome. So when you have a Horner syndrome, then you have to localize the lesion. You have to look at other somatic signs also. Other somatic clinical signs will also be there, and that will help you to localize the lesion. So that concludes our discussion of the sympathetic system. Now we come to the parasympathetic neural pathways in the fibers, and that's fairly easy because the parasympathetics they do not reach the body wall. They don't go to the abdominal wall. They don't go to the thoracic wall. They do not go to the limbs. They do not innervate the sweat glands. So they don't have to get onto the spinal nerves. They don't have those problems that the sympathetics had. They only innervate structures inside, or organs inside the abdominal cavity, the pelvic cavity, and the head. And it's fairly easy how they do that. They do that through the cranial outflow and the sacral outflow, as shown over here. This is the sacral outflow. So I will combine the sacral outflow with the outflow of the vagus nerve, the 10th nerve. The 10th nerve, vagus nerve, is going to supply the entire thoracic cavity, organs inside the thoracic cavity, as well as the abdominal cavity. And then the S2, 3, and 4 preganglionic parasympathetic fibers are going to supply these structures in organs inside the pelvis. So why why I combine the 10th nerve with the sacral parasympathetics, because they both use terminal ganglia. Now, terminal ganglia are ganglia which are inside actually the body wall of the organs. They are so close, they are so far away from the CNS, and they are so close to the target organs that actually they're inside the body wall or the wall of the organs. For example, they're inside the wall of the stomach, the bladder, for example, in the smooth muscle of the bladder. And so the postganglionic fibers are very short, and these ganglia are known as terminal ganglia. So the pelvic splanchnic nerves and the parasympathetics from the vagus, they use terminal ganglia to innervate these structures. And what's left is the structures in the head, and in the head there are 4 discrete ganglia through which the parasympathetic fibers are distributed. Number 1 is the ciliary ganglion, then the submandibular ganglion, the pterygopalatine ganglion, the otic, and the otic ganglion. So the cranial nerve 3 uses the ciliary ganglion, and it supplies 2 muscles. The sphincter pupillae, which constricts the pupil, and the ciliary muscle of the iris. So ciliary muscle of the eye, which is used for accommodation reflex. So the preganglionics, they come off from the brainstem, the midbrain, the nucleus of the third nerve is present in the midbrain. The preganglionics come out of there, and they synapse inside the ciliary ganglion. The postganglionic fibers, they come out, and then they innervate, and they reach the eye and innervate the smooth muscle of the iris and the ciliary muscle, the smooth muscle that controls accommodation. Then the seventh nerve, 3, 7, 9, and 10. The seventh nerve, some fibers of the parasympathetic fibers, they travel inside the seventh nerve. Some go to the submandibular ganglion, which supply, and the postganglionic fibers come off, and this innervate the submandibular gland and the sublingual gland. And some fibers go from the seventh nerve into the pterygopalatine ganglion, and the post synapse over there, and then the postganglionic fibers, they come out and they supply the lacrimal gland and the mucosal and the serous glands of the nose, nasal mucosa, the oral mucosa. All those glands are supplied by these postganglionic fibers coming off into excuse me, the pterygopalatine ganglion, which is supplied by the seventh nerve. Then the otic ganglion, the preganglionic fibers, they travel inside the ninth cranial nerve. They synapse in the otic ganglion. The postganglionic fibers, they supply the parotid gland. So that takes care of the parasympathetic nervous system and the neural pathways that the parasympathetic nervous system takes. So that concludes the discussion of the autonomic nervous system.